Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Two Talk, I have Dr. Jyothi Mathur. To give you a brief
Hello.
introduction about Dr. Jyothi, Dr. Jyothi Mathur did her BDS from the VS Dental College, Bangalore. She is a postgraduate in pedodontics and preventive dentistry from the Bapuji Dental College, Davangere. Dr. Jyothi has over 20 years of experience in clinical practice and in teaching. She is a consultant and has her own practice at Ahmedabad. Currently, she is the head of the Department of Pedodontics and Preventive Dentistry at the Faculty of Dental Sciences, Dharam Singh Desai University, Gujarat. Dr. Jyoti trains undergrads and interns in the subjects of pedodontics and preventive dentistry. She is also a part of the organizing committee of multiple dental camps and seminars as part of her academic duty. Dr. Jyoti has conducted research on various topics in pedodontics and subsequently published numerous articles in local, national, and international journals. Along with academics in dentistry, Dr. Jyoti is actively involved in environmental based projects. She does these projects through her private limited company launched by her. Dr. Jyoti, thank you so
Yes.
much for joining me in today's To Talk with Your Dentist conversation, and a warm welcome to you.
Thanks a lot, Rekha. It's lovely to be here with you like this. Yes, tell me.
I know. Yeah. So, Dr. Jyoti, you says you have your interest in environmental based projects. So, what
Yes.
exactly are these projects? I'm a little curious to know.
Okay. Yes, so it's like a more like a wish list. Like a few years back, I was traveling through Gujarat and came across the same old problem of not having toilets for women wherever we are going. So So I thought, we can reach out to anything. We have the world in our hands through our phone these days and the Wi-Fi, internet, but still we are having the most basic problems. So then,
Yes.
I thought, why don't I do something about it? So if I wanted to do something, if I want to take a step for something, it has to be in a proper direction through a proper channel. So I thought of launching a company of my own and trying to sort out a few of these issues. Like obviously we can't sort out. One person cannot deal with all the issues together. But at least if we can make a start somewhere, one of us makes a
Yes.
start somewhere.
Yes.
So I launched a company called Missile Environmental Solution. So
Okay.
if you read my company, what it is about, you have to, get a book published for the company, what the ideas of the company are. So it's more like a wish list where I'm,
Okay.
planning to handle the toxic waste and the byproducts and, maybe the greening the environment
Environment.
and probably, yeah, yes. And, maybe plant more trees and have some urban jungles coming up. So that is more like a wish list. But
Okay.
I'm working on it. So one of the whole things that the toilets, the problem of the toilets, the solution that I have with me is have an app, a website and an app wherein all you link all the clean toilets, the privately owned. Okay, government is working towards it, fine, but all of us women know what condition they are in. So I have an idea where I'm roping in all the nice hotels, restaurants, and resorts, and
Yes.
probably getting onto the same launch pad. Probably if I'm
Yes.
traveling on road, traveling
Yes.
by road to a place, and if
Yes.
I should know how many kilometers I need to hold my bladder to make
Keep
my
prepared.
journey more comfortable. So that's
I
how,
know.
because as a woman, you stop enjoying the trips. If you're more
Exactly.
concerned with where you're
I
going
know.
to
I
have
know.
a break. so I, so this is, it's still, in the pipeline. So
Okay.
thankfully, I'm reaching the conclusion of whatever design that I have
Great.
in my mind.
Great.
And I'm shortly going to launch this. It's in the form of a website and a mobile app. So let
Okay.
me see how many months it takes because, we were ready with the launch, but then this corona thing happened. So now
Yes.
everything is postponed. So travel and tourism sector anyway is very down these days.
Yes.
So eventually, maybe by next year, it will happen.
Yeah.
So
Yeah. I think.
this is one of my side track project.
Okay.
It is not related to dentistry at all, and that's why I was thinking that whether we should discuss it on this platform or not.
No.
But
No.
it's fun.
I know. I
I like
think.
talking about it.
Yeah, I know. I understand. I understand when you're passionate about something and you so strongly feel about it. you would
Yes,
want to tell so many people, like, hey, look, this is what I want to do, kind of a thing.
exactly.
And I think,
But
your thought of, giving a much greener environment to our next generation and the coming generations.
correct,
I think that's one of the best things that, as people from this generation, we can do.
yes. So I thought if I had to do something, basically we all reach a stage in whichever profession that we are. Everything was nice, everything is okay, but then you still would want to do something more. So if
Yeah.
I want to do something else, it always, I localize it. I'm not a trader, I don't sell things, I can't market things. So
I
I
know.
would rather do something for the environment which has a longer lasting effect on
Yes.
everyone around. So at least
Yes.
it's just a start. It's an idea. Let me see
Yes.
how it materializes.
I'm sure you'll go a long way in that, Jyoti. I'm sure.
Okay, thanks a lot. Thanks a lot.
Great idea.
Okay.
So,
Yes.
so
Thank you so
then,
much.
yeah, I know. Today was an off day, but still, I think you were so kind enough to join me on this talk.
It's I'm also honored that you're invited me to this panel or this interview.
It's nice to have you, Jyoti. So, tell me, when in your profession, like you're a
Yes.
periodontist, means you deal with
Correct.
child patients.
Hmm.
So, generally, I'm sure even the kids probably have some kind of, they're curious to know about so many things. But I think even the
Correct.
parents want to know a lot about their child's teeth and development. So,
Yes.
generally, what are the kind of questions you get asked?
Okay. So the first question that I get asked is, why should we brush the teeth? Or
Hmm.
why should we brush at night? Because
At night.
that is what the first thing that I insist is that if you want me to start the treatment, you have to start making changes at home.
Yes.
And because a child is a part of the family, and a child will copy what the parents and elders are doing. So I tell the parents that you please make it a habit. Oral hygiene has to be a family habit. It's like you spend time with your family. All three or four of you in the family are together and probably brushing your teeth in front of the child. The child feels a part of it and they would want to brush their teeth. So it's not like an activity which is just forced onto the child alone. So
Yes.
because I'm surprised, most of the parents, they find that at a task. It's a task for them to brush their teeth in the night. So that is the first and foremost thing that I tell them. See, I can only fill up. You can come to me once in 6 months. I'm going to fill the teeth, but the rest of the care has to be at home. Otherwise, the treatments are a failure. Whatever
Correct.
we do is going to be a failure.
Correct. Correct.
Yes.
Correct. I know. So I think to incorporate the good habits in the child, probably it's
Hmm.
more like a tell, show, do that we
Yes,
generally study. You know,
exactly.
huh.
So,
So unless the parents don't show it to the children that they are doing it, and I think
ha,
at that point they don't even have to tell them do it because the child is
correct.
watching them do it, and he says, okay, this is
Exactly.
normal, this is routine, even I have to do it.
Even I have to. So it's not a task. It's not like something extra out of your whole day, that you're taking out. And then one thing more that I add on to this is that you just need about between 2 to 2.5 minutes. That is 2.5 minutes maximum for your oral care, and then nothing else beyond that.
I know.
So so that 2.5 minutes, if you take out at the end of your day for yourself and your family and your child, you're going to be benefited a lot because it's going to take care of 90% of oral problems. Okay,
Yes.
so
Yes.
you may not need to go to a dentist at all. So that is my way of explaining to them.
Yes.
So
Yes.
some
Yes.
of them take it, some of them don't.
You don't.
So let's see.
I
Yeah,
know. I know. So
that is
so
how life is.
yeah. So I think also, Dr. Jyoti, I think what generally we also get asked is, especially when there's a mixed dentition, that is when the child is around the seventh, eighth year, when the milk
Hmm.
teeth begin to fall off and the
Yes,
permanent teeth have started to come. I think parents have a lot of concerns about their child's teeth at this age because I think the teeth probably look a little different. They look a little bigger
yes,
as compared to the size of the jaws and the face.
yes.
So, what is the kind of questions you get when it comes to these
Okay.
aspects?
The number one question is the color. Why is the color not the same as before? That is, because they also are observing. They may not be trained in dentistry, but the observation part is there that the new teeth which have come, they are not the same color as the earlier teeth. So we have to explain that this is normal. The second aspect is the shape of the teeth. See,
Mm.
permanent teeth will be uneven. They have a structure called as mamelons at the end, at the tip of the teeth. These are uneven structures. which wear off over a period of time. So as an adult, you don't see the uneven shape of the incisors, but all children, when they have the teeth come out in the mouth, they are like that only. So that is the first concern. Third concern is second concern. Sorry, the third concern is with regards to the spaces. So up to a limit, that we tell them between 1 to 2 millimeter of spacing is normal for children. So they should not really get worried about it. But yes, they should be going for a checkup maybe every 6 months. And if anything is required, if any early braces are required, they can be informed about it. So they can know in advance whether the child needs braces or not.
Yes or not. Yes.
Whenever the time comes for that.
Yes. So I think a periodic checkup is kind of mandatory in a child.
Yes, definitely. It should be done. It should be done. Yes.
So
Yes.
that even as dentists, we kind of make a graph of the growth of the teeth and the jaws, and we know if any correction or
Exactly.
further treatment would be required.
See, one thing is caries. Caries is a major, what do you say, the one evil that we are all fighting as dentists. So cavities, if they are caught at an early stage, so you can probably prevent them from
Hmm.
happening.
Hmm.
If you can have the diet chart of the child, whatever he or she has been fed,
Yes.
if whether any corrections are required for that. Second
Yes.
is orthodontic problems. Definitely, like if the jaw size is not growing in what you said, the size of the teeth are not matching to the, or there is a mismatch, you can say there's a mismatch between the jaw size and the tooth size. Of course it will lead to some problems, but we can, as dentists, especially as pediatric dentists, we can see those problems
Problems.
before they
Much
actually
earlier.
get manifested. So
Yes.
we can make them out very early, and it can be suggested to the parents that if required, you should get it done. See, I'm not saying all patients require early treatment.
Yes.
Let's say about 20% will benefit a lot
Yes.
with early treatment. 80% will not. But if your child falls into that 20% category, so you can give the benefit of the treatment, early treatment to the child,
Yes.
because it is very important for the facial aesthetics also. So if there
Correct.
is a skeletal growth correction that is required at an early age, the
Yes.
child's face itself is affected. The aesthetics of the child's face, the lip position, the nose, etc., that all can be corrected
Correct.
while the growth is taking place. So
Correct.
that is the advantage. So
Correct.
whenever the child is in growing phase, we can alter these characteristics to an extent to make them more aesthetic. But
Correct.
once the growth phase is completed, like sub 17, 18 or 19 or maybe 16, late teens if the child reports in, then there is no growth potential remaining, not
Correct.
much. So
Correct.
ultimately that if there is any correction required, it mostly goes towards a surgical option. And Rekha, how massive these surgeries are, like oral and maxillofacial for aesthetic correction, they are
Yes.
pretty radical. So
Yes.
to
Yes.
prevent that, we can have, early checkup and
Early.
early treatments and
Yes.
early intervention, not for
Yes.
everyone, but yes, for
Yes.
that, those 20% of the cases. Yes.
Yes, 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 yes. So, Dr. Jyoti, you did tell about having a proper diet chart for the child.
Yes.
So, how what would you suggest? I mean, as a general rule, I'm see, of course, that is something that you have to very specifically sit with that particular child and the parent and discuss their diet habits.
Correct.
But in general, if you have to say, because we know starchy and sugary foods are the main culprits when it comes to tooth
Yes.
decay in the child. So generally,
Correct.
what would you recommend the diet should be like for a child?
Okay. See, what I say to people and what I say to my patients, both at my institute and my clinic, is that if there is no manifest problem, if there is no problem in the child's dentition, like so many times, this is another common question, like somebody's grandfather or somebody's grandmother never went to the dentist. So they had very good teeth for their whole life. Now, see, that is genetics. That is probably being lucky, and that is probably reflecting on the diet and the habits that were prevalent
Those
in
days.
those times,
Yes.
the yesteryears. Okay.
Yes.
So, what I tell them is that if the child does not have any problem, as a person also, if you don't have any problem, whatever you are doing, keep doing it, right? Whatever
Correct.
toothpaste you're using, whatever brush you're using, whatever food you're eating, if it's not leading to any problem, any clinical
Correct.
problem, then that's fine for you. But
Yes.
if you are turning up to a dentist with specifically problem of extensive decay, all so many teeth are getting caries, that means there is some problem. So
Correct.
to identify that problem, we have to note down what the child is being given along with the time. So it is
Correct.
just for an investigation, like what we are doing. So many times I ask them, but then parents don't can't recollect. Every day whatever I'm having, maybe I
Yes.
will not recollect it tomorrow also. It is not
Yes.
possible humanly to recollect everything what I put in my mouth the whole day. So
Exactly.
we observe, we this is just for the observation and investigation. We ask the parents to make a diet chart, like whatever the child is being given for, maybe for 1 day, 2 day, or 3 days,
Yes.
and with the along with the timing it is written, and this
Yes.
is the report that the parents get to us. That okay,
Yes.
this is what we have noted down. Like if at 6 o'clock the child was given two biscuits, and
Yes.
at 7 o'clock the child had one small chocolate, then
Yes.
at 8 o'clock the child had dinner, and at 9:30 the child was given a glass of milk,
Correct.
and at 10 o'clock the child slept. Okay,
Yes.
so this is the usual pattern. So if the child is having absolutely no issues, no problem, it's fine, continue. But if the child is coming up with early childhood caries and rampant caries and
Yes.
nursing bottle caries, that means
Yes.
extensive caries in all the teeth, so many times entire dentition is destroyed, then
Yes.
we have to tell them to please change the timing of the milk. Please
Yes.
do not give biscuits in the snack time.
Yes.
Replace it with healthy options, like maybe some boiled chana, or whatever is the, see, local diet is very good, like whatever we have now.
Yes.
You, what do you call this, the peanuts, like in
Yes.
the local Gujarati language we call it seeng dana over here. I don't know what, like
Yes.
every
Yes.
state in India we have these small snacking options which are very healthy, and they are
Yes.
made of whole wheat, and the regular the
Yes.
apart from the wheat also, they are like not fermentable carbohydrates. They are like multi-chain carbohydrates, like bajra is there, or some
Yes.
some alternate to wheat is there definitely in the local diet. So we
Yes.
should incorporate that as your snacking habit. So
Correct.
these are the minor changes that we can tell them, but only if we as dentists know what the child is being fed. So,
Correct.
in fact, from changing from just the fill it, shut it type of mentality, like, like the child is having one
And
cavity, I will
and I
look
took
at this
them to
as a dentist, and I will just do some
the
filling over there and send the child back. And then after 2 months, again, the child will come back with another tooth. So, this is what used to happen earlier. Nowadays, of course, we are following the medical model where we would like to know why this is happening and try to
correct.
prevent it from the beginning.
Yes, yes. So,
Yes.
so Dr. Jyoti, when you say preventive care, of course, there is what we do when we do treatment is something like fillings that we do in the child.
Yes,
So,
yes.
when it comes to preventive care from the dentist side, what are the
Hmm.
kind of treatment options that are available in the preventive care?
Okay, so the best options these days, the ones which really work with everyone, with all the children, number one is fluoride application. These are like the same element. Fluoride is the same element which is added into the toothpaste
Yes,
and other mouthwashes also. But toothpaste and mouthwashes, because they are meant for home use, it is meant for general public. That is why the amount, the percentage, or the concentration is very less. Okay. So what we apply as a professional application of fluoride, they are highly concentrated, but they are very effective. So they are
yes,
present, they can be available in the form of gels and varnishes, and multiple applications are there, multiple different types of methods of application are there. But the idea is that they are highly concentrated. So they
yes.
should not be given in general public. They should be, the application
Oh,
should be done by the dentist
yes,
along with a good suction, so that the child does not ingest these compounds.
yes,
So this provides an excellent preventive option, wherein the chemical structure itself is changed. This is what I explain to all the parents.
yes,
Chemically, fluoride is incorporated into the enamel, and that is more resistant to decay. So that is
yes,
the first pillar of prevention, I would say. Second pillar of prevention in the dental operatory is the pit and fissure sealants, and
yes,
there are certain specific filling materials which are available, which will treat the caries, and they will also prevent caries from happening in newer areas in the same tooth. Third
yes,
pillar of prevention is diet and
yes,
oral hygiene, which
yes,
we can't control as a dentist. So
yes.
sometimes, I joke with my patients that, look, okay, so look, if you can't brush your child's teeth, I will come to your house and brush the teeth every night. You tell me the timing, I will come to your house and do it. So this is what I have to offer them. So then they laugh. We all have a good laugh
No,
about it. But
I know.
then
But
it's,
yes,
yes.
yes. Yes, but I think that's again very important. Like you said, like sometimes I tell my patients, like it's like the everyday care that you have to do at home is more important. Once in
It is
4 months,
more
once
important.
in 6 months is what we do. But
Yes.
everyday care, from their end. So I think that is the whole idea of to create some more awareness about small
Yes.
little things when it comes to dental
And
hygiene.
one more important thing is flossing. I think most of us in India, we just avoid it. I don't know why. We have heard the name, we have probably seen it being used at some point by
Yes,
somebody else, or maybe watch some videos, but we don't do flossing. For most of us, don't. I have to
yes,
explain it to my parents that this is floss and
plus
this is how you do it. And
yes,
options are also available, different options. Like there's something called as water pick available, online marketplaces. So there are multiple options. They are very, very interesting, I would
yes,
say, and
yes,
quite good if you follow any of these. It's not necessary to buy all that equipment and only then your teeth will be clean. You can do
yes,
hand flossing also, but these
yes,
are like, these are attractive because they are the newness.
yes.
They're like a new toy for a child, or even
Yes,
the adults. They would
yes.
enjoy doing that. So as a result, the teeth become cleaner.
Yeah, I
So
know.
that is what is, newer technologies are available, so they can use them also.
Yeah. So, Dr. Jyoti, just in case, just by chance, what happened? Unfortunately, for whatever reasons, the child's caries index, what we say, the amount of caries in the child's mouth is high, and then sometimes
Yes.
these tooth decay go into a deeper infection of the nerve.
Hmm.
So that's
Yes.
when the tooth gets infected. So what
Yes.
happens at this point?
So we have to then, at a certain point, when the pain becomes unbearable, children are, they are very playful. So they will not usually complain of pain for any small little thing. They take it in their stride. So
Yes.
over a period of time, even the parents realize that if the child is complaining again and again, at the
Yes.
night time specifically, if the child is complaining either before eating or after eating or while sleeping down, I mean, while lying down. So all these are indications that the child requires a root canal treatment.
Yes.
So it is a little different than root canal. I think I'm sure everybody is aware of what a root canal treatment is. So there are little differences, variations in the permanent, that is the adult tooth root canal, and the milk tooth root canal. But definitely, if the cavity has reached so deep so as to touch the nerve inside the tooth, so then
Yes.
definitely the only treatment option available is root canal treatment, and parents have to get it done. So many
Yes.
times, what happens, in my experience, what happens is the parents avoid, just by the name of it, root canal, we don't want to do it. But then
Yes.
what they don't realize is that it's the child, their child, who's undergoing all that pain.
Yes.
And believe me, antibiotics are no option. You know that, Rekha.
I know.
Antibiotics and painkillers, just giving them syrups and medicines over a period of time,
Doesn't help.
it is not going to solve the treatment,
Yes.
solve the problem. So in
Yes.
fact, dentally, a medicine that you can eat does not solve any problem at
Any
any
problem?
point of time.
Yes.
So you
Yes.
have to seek treatment, you have to get it done. That is
Yes.
what I wanted to tell people. And please don't avoid, because it is your child who's undergoing all that painful episode, and it
Yes.
is traumatizing to have dental pain.
I know it is pretty much. And
Yes,
considering, like you said, children are probably a lot more stronger in that sense,
yes,
because they probably
they're
put up with,
resilient.
yeah, they're more resilient. Yes. Yes. So I think at any point, if your child is complaining, that means he truly, really has a problem. So I think
Yes,
parents have to pay attention to it,
they
and
should.
understand that the child has a
And
problem.
one very common sense outcome of a lot of destroyed teeth in the oral cavity, if the parents are seeing that there are big holes in the children's teeth, and child cannot eat properly, so the direct consequence is malnutrition and the
Yes.
child being underweight. So
Yes.
we deal with that also at a point of
Correct.
time, because then the parents realize that the child is not eating properly. So
Correct.
I have come across children who are at 3 years of age, they are fed purely milk because they refuse to eat. So
Yes.
it's a vicious cycle. The child can't eat, so he's been kept on milk only, and milk leads to a lot of dental decay. And then
Yes.
again, the child cannot eat. So
Yes.
it goes on and on and on until a definitive dental treatment is taken.
Taken care of. Yes, yes,
Hmm.
yes, yes. So I think, Dr. Jyoti, that was a very informative talk. That you shared your so many years of experience in the field of pediatric dental care, and I
Okay.
really hope all our viewers who watch this conversation are
Hmm.
benefited by it.
I'm glad I could be of help. And if somebody can understand the importance, and
Sure.
if only one person can understand, I'll think that whatever I've done today is worthwhile.
Fruitful, yes, yes.
Yes.
So, Dr. Jyoti, thank you again so much for joining me, and I really hope I can get you back to do another talk
Okay.
on this.
I
I'm
would
sure
love to.
pediatric dentistry is such a vast subject. You know, there's
It
so
is.
much parents need to learn and understand about their child's tooth, and I really hope I can get you back to do another talk with
Yes.
us.
Definitely. Definitely. I would love to join you. Okay.
Yeah,
All right.
thank
Bye,
you so much.
Rekha. Bye.
Bye,
See you.
bye, bye. So, viewers, that was Dr. Jyothi Mathur, who did share with us her experiences when it comes to your child's dental care. So, if you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. Until next time that I come back with another dentist and another expert to talk to you about your oral and dental health, keep smiling, stay safe, and be happy. Thank you.